Okay, hello everybody. This is Ben Wheeler here at the University of Exeter Medical School down in Truro in Cornwall. I've got Shanda Bell here, who some of you will have been in touch with. And we're running this first webinar in a series that we've started in association with our SWEEP project. So I'll just do a very brief introduction to the SWEEP programme and this project, and then I'll be handing over to Rupert Lloyd from Public Health Dorset to kick us off with the first webinar. As some of you will be aware, the SWEEP project is the Southwest Partnership for Environment and Economic Prosperity, funded by NERC, and this is run by the University of Exeter, PML, Plymouth Marine Laboratory, and the University of Plymouth. And the whole SWEEP programme is all around, particularly focused on the Southwest region of England, looking at applying research to benefit our environment and economy. So taking the environmental science research that we've got and turning it into useful societal material and impacts. And so we have one of the projects within the SWEEP programme, and that project is called Informing Investment in the Environment for Health and Wellbeing. And there's a web link there on the slide. So you can go to sweep.ac.uk and find out a bit more about what we're doing and what the project's all about. So without further ado, I'll hand us over to Rupert. So the way we're going to run this is Rupert will present for about 20 minutes or so. Hopefully you can see his screen shared with you. If you've got any questions that arise as we go along, you should be able to type them into a chat box. So hopefully you can find the chat tool on the Zoom webinar, and you should be able to type any questions or queries into the chat box. And so what we'll do is Rupert will talk for about 20 minutes or so, and then we'll have time for questions and answers. And so you can ask your questions over the chat, and we can relay them on to Rupert and see where we get to. So hopefully this will work all right. It's our first webinar doing this, so any teething problems hopefully won't be too much. But again, if there's anything significant, like you can't see slides or something, do put a query into the chat box and we can see what we can do. Okay, without further ado then, over to you, Rupert.
Brilliant. Thanks, Ben. And hello, everyone. Thanks for joining us today. It's a bit of a grey, drizzly day here in Dorchester, so it's nice to be in a warm, dry office talking to you guys during Friday lunchtime. So, as Ben said, my name's Rupert Lloyd. I'm a project coordinator for Public Health Dorset, based with the team in Dorchester. And this afternoon,
sorry, Rupert, I'll just briefly interrupt you. I should have mentioned we're actually recording this webinar, and the recording of the webinar will be made available afterwards for people to catch up with. But that does mean that Q&A through the text box and so on will be made available publicly, just in case anybody needs to be aware of that. All right, thanks. Sorry, Rupert.
That's okay. Yes, so this afternoon I'm going to talk about the work we're doing in Dorset to increase access to the natural environment for health and well-being through our Healthy Places workstream. So I thought I'd do 4 things. I'm going to start off by setting the scene and explaining how the work I'm talking about fits into some of the wider goings on in the world of health and care in Dorset. Then I'm going to explain what we're aiming to do through our Healthy Places work programme. And most of what I'm going to do is share with you some of what we're doing, some case studies of what is going on locally in Dorset. And then I thought I'd finish with a bit of what I think the future holds for us. So to kick off, a little bit of background. As I said, I work for Public Health Dorset. We are a shared service between Bournemouth Christchurch and Poole Council and Dorset Council. We've got a public health team that brings together a pretty diverse group of people and functions. And we also, as of last year, have an in-house behaviour change service called Live Well Dorset. And Live Well offers support to people to quit smoking, drink less, lose weight, and be more physically active. So a big link on that last point about physical activity, in particular with what I'm going to talk about today. So we've got one overall team, but within that 2 kind of main areas of focus. And as some of you might know, we've recently gone through a process of local government reorganisation in Dorset. So prior to the 1st of April, we had some borough councils, a county council, and I think 6 or 7 district councils. Since the 1st of April, we have 2 unitary authorities. So the landscape has got a lot simpler in that sense. We've got BCP Council and Dorset Council. Those organisations are still relatively new, and we're in quite an interesting time, I think, at the moment, as they work out what their priorities are, and we as a public health team start to build closer relationships with some of the services that were maybe delivered by the district councils in the past and that we've had less contact with up until now. Then, looking at the wider picture, Dorset has an integrated care system, or ICS, which was launched last year in 2018. And as many of you will know, the ICS is a partnership of health and social care organisations. So here in Dorset, the Clinical Commissioning Group, or CCG, NHS partners, and the local authorities. What the ICS means in reality is pretty complex. And is still developing, but for me, down in my lowly position as a member of the public health team, I think the key function for public health in the ICS is our focus on prevention at scale, which is kind of the foundation, if you like, of the wider change and transformation that's happening in the health and care system in Dorset. This is the official definition of prevention at scale that features in the last Sustainability Transformation Plan and the new one, or the new draft one, which is our Dorset looking forward. I think I prefer something a bit more simple, like helping more people stay healthier for longer. But however we describe it, I think we all know what we're talking about, and we all know why prevention is important. And at Public Health Dorset, our approach to prevention is structured into 4 work streams. So we've got starting well, living well, aging well, and last but not least, healthy places, which is what I'm talking about today, as kind of a cross-cutter focused on the built and natural environment as a key determinant of health. What is healthy places? Well, it's our catch-all term in Dorset for the work we're doing to try and positively influence the role the built and natural environment plays in shaping health and well-being. And this afternoon, what I'm going to focus on is some of the kind of practical work happening to increase access to and engagement with the natural environment. We're doing that through direct collaboration with our colleagues in the 2 local authorities, the 2 councils, and through some wider partnerships, wider working across the system. So trying to bridge the gap, I guess, between the health and environment system locally. And I've chunked some of that work up into 3 broad areas. So what I'll talk about today is intelligence, so building shared understanding across the system of the opportunities the natural environment presents for health and well-being, and also developing our local evaluation capability in Dorset to be able to evaluate and understand the impact of some of the projects I'm talking about. Then, as I said, working across the system, collaboration with our partners, both in the environment sector and in the health and care system, and also a number of demonstration projects we've worked on with others, which, thinking about what SWEEP is all about, has been trying to take the evidence base and operationalise it and create local kind of case studies or exemplars of what we can do. I thought this was a good time just to flag some of the partners we work with beyond that. The local authorities, the councils, and the health and care system. So they include Dorset Local Nature Partnership, who coordinate Natural Choices, which is our local kind of green prescribing offer. Dorset Area of Outstanding Natural Beauty, the Parks Foundation in Bournemouth, and some others. And I'm flagging these guys here because pretty much everything I'm going to talk about is being done with or through these guys and with our colleagues at the councils. What I'm talking about are examples of trying to work with others. There's not much, stating the obvious, that we can do in this area as a public health team working in isolation. So collaboration has been key. The first piece of work I wanted to share with you is a project that we worked on with the European Centre for Environment and Human Health at University of Exeter. As Ben invited me to speak, I thought I'd better mention this one first. And what we set out to do here was to try to understand how green space or access to green space varies across Dorset. The question we wanted to answer is, where is access to green space worse, and what are the opportunities to try and address that deficiency or those deficiencies? Because we thought if we could answer that question, we could develop a stronger narrative for engaging our partners in planning for what we could do about it. And what we did, in a nutshell, is a GIS analysis of access on foot to publicly accessible green spaces within our 2 local authority areas, so within BCP and within Dorset Council area. I'm not going to go into too much of the depth and the detail of how we've gone about this project, but there's a web link down at the bottom of the screen to where you can find out much more about it. But in essence, what we had to do is create 3 basic building blocks. So we needed a green space database for Dorset, something that brought together all our publicly accessible parks, nature reserves, playing fields, public rights of way in the open countryside, etc., etc. And at the outset, we thought that would be the easy bit. So we thought we could just take what our local authority colleagues had, combine it, and we'd be good to go. Actually, it wasn't that easy. The data we had available about, the spatial data we had available about where our green spaces were and what they are, wasn't consistent or complete in many cases. So we had to think quite hard about what types of space we included. Then the second building block was that we had to create a walkable network. So what we wanted to do was model where people could safely walk to access their local green spaces. And that meant integrating our highway network with the public right-of-way network, and then doing a bit of a filtering exercise, I guess, to remove sections that wouldn't be accessible or wouldn't be safe to walk on. So A roads, for example, roads without footways, pavements, whatever you want to call them, and that kind of thing. And then the third building block, the final piece in this puzzle, was how we connected them together. So we had to create access points, digitize access points for the green spaces. And something that was useful, came in handy for this, was the OS's open green space layer, which has quite a bit of detail about where access points to public green spaces are. But we had to supplement that by working out where the walkable network we created intersected with our public green space. So by doing that, what we've created, what we have now, is a tool that allows us to quantify and compare access to green space across Dorset. So this map on the slide is taken from one of our visualizations of that work. And what we've mapped here is, as you can see, hopefully from the key in the top right-hand corner, the percentage of the population of lowest super output areas, LSOAs in Dorset, of people that live within 300 metres of a safe, 300 metres safe walk of a public green space that's half a hectare in size or bigger. Why 300 metres? Why half a hectare? Well, we use that threshold because it was the World Health Organization's suggestion of what constitutes adequate access to natural environments. So in the absence of any better option, it seemed like the best starting point to start a conversation. What we found, or the headline of that bit of work, is that 49% of people in Dorset don't meet the WHO's suggestion. Now, obviously, some of them might only live 350 or 400 metres from a green space, or they might live very close to a high-quality green space that's, a bit smaller than half a hectare. But as I said, what we wanted was a tool that we could explore some of these questions with, and start to engage some of our colleagues in thinking about how access varies across our patch. And I think that headline figure is important for us because Dorset is generally seen, quite rightly, as somewhere that is well served with, high quality, outstanding, accessible natural environments. But and it is. But even so, our analysis showed that access isn't equally distributed across the population. So we do have areas of opportunity to try and improve things. However, there's some buts. As always, you answer one question and it opens up lots more. One surprise for us is that when we looked at deprivation, we didn't find what we expected. What we thought we'd find is that our more deprived communities in Dorset would generally have worse access to green space, which seems to be, the picture nationally. but that relationship wasn't very clear for us in Dorset. So in this screenshot on the slide, I filtered our map to only show LSOAs that fall within the 100 most deprived in Dorset, according to the 2019 Index of Multiple Deprivation release. And if you look at somewhere like Boscombe, for example, one of our more deprived areas, or I think it's just off Shot actually, Turlin Moor, but maybe one of the northern areas of Poole, what you can see is that using our measure of adequate accessibility, things are pretty good, but at the same time, these are also one of, or some of the most deprived communities in Dorset. Now, I think that's interesting because what it highlights is something that is probably obvious to most of us, which is that proximity to green space isn't everything when it comes to how we use it and the kind of potential impact it can have on our health and well-being. We might be more likely to engage with green space or nature if it's nearby, but even if we live close to it, there can be other barriers to using it, like the type of space, what it provides, the quality of the space, and so on. So yes, proximity is important, but as this piece of work highlights for us in Dorset, quality and type of space is important as well. So with that in mind, one of the things we've been working on with our colleagues at the councils is testing and demonstrating what we can do to try and increase access to green space through improving quality, for want of a better word. And a lot of this is what they do anyway and do very well. What we're trying to build within the wider system is awareness of the importance of investing in this kind of activity for health and well-being, why it's an important part of the jigsaw of prevention at scale. And in Dorset Council area, we've worked with our countryside development officer, a lady called Tara Hansford, to enhance some little demonstration projects of local rights of way to make them more usable. So simple stuff, things like improving surfacing, signage, drainage, and so on. But really importantly, working with and trying to ask the community that uses it what they want their local public right of way network to provide. And that's important because our analysis of access to green space indicates that around 185,000 of us in Dorset rely on the public right of way network as our closest publicly accessible green space. Lots of us, particularly in the rural west, won't live near a country park, a formal park or garden, but what we do have is an extensive public right-of-way network that allows us to engage with the natural environment. Over in BCP, we've got a bit of a different challenge. In the urban areas in the east of Dorset, our challenge is about trying to facilitate use of parks and green spaces for groups in the population who might face barriers to doing so. So we work with BCP Council on a couple of projects designed to try to address the needs of specific groups or tackle barriers in accessing green space that they'd identified themselves. And one of these was focused on young families. And as the quote on the slide suggests, trying to support them to use and enjoy their local green spaces more. And thinking back to the beginning of this project, a couple of years ago, the starting point was that our colleagues in Borough of Poole Council, as it was at the time, had identified that they had some spaces where young families were, they believed, underrepresented. And generally, those spaces could also be described as being of lower quality, so less well equipped, less attractive for people who live nearby. And we work with the council and a local nature-based play provider to deliver a programme of activities to find different ways of using them and enjoying them for young families. Then moving on to Bournemouth, another project I wanted to mention is Bournemouth Parks Foundation's Parks in Mind programme. This has been led by the foundation with funding from various organisations, including Public Health. And this project kicked off or started from an awareness at Bournemouth Council that they had a number of green spaces in and around Boscombe that they thought needed some improvement, had issues around maintenance and quality, and in some cases perceived or actual antisocial behaviour. And at the same time, in that community in Boscombe, they recognised that there were people living with social isolation and mental health issues who could benefit from taking part in environmental volunteering activities. So their aim was to try to put together a programme that could address both of those needs. So try and provide inclusive volunteering opportunities to support access to green space, support the well-being, health and well-being of participants, and also at the same time create or strengthen the volunteering base to work with existing Friends of Parks groups on addressing green space quality. And over the last year, so since October of last year, that group's been led by a wonderful guy called Peter Holloway. They've delivered about 140 activities at the last count, engaged 105 people living in and around Boscombe, and they've had kind of a core group of about 40 participants who've taken part in 6 or more activities, so those kind of regular participants. And what's been quite interesting is how that project over a relatively short period of time has had some kind of spin-off benefits and generated interest in trying to take the same model and apply it to other areas, both within and beyond BCP. So little article, headline from the Echo there about how Friends of Niverton Gardens, one of the Parks in Mind sites, had been successful in securing some pocket park funding from the government through their work with Parks in Mind. And moving on, back in Dorset now, back in the area of outstanding natural beauty. One of the other projects I wanted to share is Stepping into Nature, or SIN for short. SIN is a lottery-funded programme led by Dorset area outstanding natural beauty, and it grew out of a pilot project about 3 years ago. What they do is they work with several different environmental activity providers in Dorset, like the RSPB, local authorities, the rangers within those councils, Greenwood Club, and some others. And what they're trying to do is deliver inclusive, nature-based activities for older people, people living with dementia, and carers, aiming to embed a kind of a sustainable approach or sustainable change in how those individual organisations deliver activities and manage sites beyond the lifespan of the project to ensure they meet the needs of that core target group. Our role, or Public Health's role, in Stepping into Nature has been to lead the project evaluation. I probably haven't got time to go into this in huge depth, but please take a look at the project website. I think I've put the link down at the bottom of the slide if you want to find out a bit more about what they're doing and how Public Health have been involved. What I wanted to highlight is the evaluation framework that we've developed for that project and the user guide for that. And a key kind of outcome that we were trying to achieve through that, as well as giving us a firm foundation for evaluating and demonstrating the impact of the Stepping into Nature project, was across the environment system, across providers of this type of project, try to increase capability around evaluating and demonstrating impact. So a lot of the providers and other organisations that have been directly involved in Stepping into Nature have also been involved in developing the evaluation framework and have had training in how to try and use it and apply it to their own projects in future. I thought I'd take a pause at this point and reflect, because I imagine that a lot of what we've spoken about might seem pretty familiar to many of you, depending on who we've got on the line. And I've stolen this slide from a presentation a colleague gave a couple of weeks ago. He was reflecting that he started his career, I think, as a ranger about 20 years or so ago, and has been tussling with similar issues and trying similar things since the beginning of his career, about how we improve or develop the contribution that nature and environmental volunteering makes to health and well-being, which begs the question, what's changed for us here in Dorset, which was a little bit of a kind of prompted a moment of reflection when he said it. But encouragingly, I think he also said that he's seen enough change to still feel positive. So for me, what I think we're seeing is a local shift in awareness and understanding of the value and the opportunity of natural environments within the health and care system locally. So a couple of weeks ago, I was at a workshop led by the AONB, Active Dorset and the local nature partnership along with us. And we had about 40 people in the room, all under the kind of headline banner of tackling the question, how can we increase collaboration between the environment system and the health and care system going forward? And what was, quite heartening was there are people in that room who've been working in this field for much longer than I have. And they said that, even 5 years ago, we wouldn't have had the level of energy and enthusiasm under one roof that we did at that session. And we probably wouldn't have had, or almost certainly wouldn't have had, some of our colleagues from the clinical commissioning group, public health and social care, who were there on the day taking an active part in the conversation. So for me, I think that shift in local collaboration and understanding certainly hasn't solved all our problems, but it's promising that we're seeing a shift in the right direction. What I wanted to do to wrap up after that canter through just a little bit of what's happening in Dorset is say a bit about what is on the horizon for us and where we're going next. So, as I mentioned at the beginning, we've got two brand new local authorities in Dorset, BCP and Dorset Council, and both of them are aiming to adopt a new local plan by 2023. And for me, this is quite exciting. It has to be one of the key opportunities we've got locally for shaping healthy places. And a key part of that is how local planning policy and development can provide green space, natural environments for people and for nature. I'd say we're probably fairly on in our journey in terms of how we work with our colleagues in spatial planning on policy development. We've started to do it over the past year or so, but I think the trick for us is going to be understanding how we can provide the kind of evidence and support that planners need if they're going to turn aspiration around access to green space and health and wellbeing into policy that can be signed off and stand up to inspection. And that leads me on neatly to another big area of focus for us for the next 12, 18 months or so, which is working with BCP on their Future Parks Accelerator project. This is, or Future Parks rather, is a joint Heritage Lottery Foundation, HLF, and National Trust programme. And BCP is one of 10, I think, FPA projects across England, and they secured £700,000 worth of funding over 2 years, with the headline aim of discovering how parks and green spaces could be better used, managed, and funded to serve communities' needs and aspirations now and over the next generation. And I think this is exciting because the project as a whole is about recognising the pressures parks and urban green infrastructure is under and giving us an opportunity locally to try and rethink how they're used, how they're funded, and how we engage people in shaping what they want their local spaces to provide. So our colleagues at BCP have articulated as how do we kind of shift the relationship with communities from local councils being the provider of green space towards being a partner and a facilitator of how local people want to use their space, green space, and what they want to get out of it. So, casting our mind back, if we think about some of the spaces in BCP, like Lower Gardens and Niverton Gardens, these were sites that were first created to suit the needs of the population back in the 1870s or so, give or take a bit, and they've evolved over time, but we can be pretty sure that the needs of the population have changed and how people want to use them has changed and will continue to do so in the future. We're still at kind of relatively early stages of working out where that project will go in terms of health and well-being, But I think the key things and what will be really interesting to test is how we can develop a local approach to community engagement, to involve communities in developing a mixed approach around improving quantity of green space, quality of green space, and activities and interventions that can facilitate access or animate those spaces in a way that perhaps we haven't done in the past. And also through that bring to life a narrative which will inform a key output of the Future Parks programme, which is a green infrastructure strategy to inform the local plan. So again, brings me neatly back to local plan development as a key opportunity for us. That was a bit of a whistle-stop tour. I hope you found it interesting. As I said, I'm sure Ben's going to circulate the slides. Ben and Sean will send the slides around. I've included a few links, and I'm happy to take questions now, but also if there's anything in there that anyone finds interesting or wants to find out more about, then please get in touch. Happy to speak to you.
That's brilliant. Thank you very much, Rupert. That's excellent. Really interesting stuff. So we're open now for questions if people have them. I don't know if you'll be able to use the chat or Q&A button. If you've got questions you can type. Do you have a go at that? Maybe I'll kick off with a question just if people are gathering their thoughts. And Rupert, I wonder, this is a bit of a big question and it's quite a hard one to answer, but it seems to me that Dorset is one of the places that has been pretty successful in this kind of way of working across sectors, from public health, environment planning, other parts of local authorities and local services. What do you think it takes to make that work?
Thanks, Ben. That is a big one.
Sorry.
I think what has helped for us, and I referred to at the beginning of the presentation, is having the foundation in place in some of those, it's quite dry, but some of those key documents like the Sustainability and Transformation Plan, the first one and the second one, so that it's writ large in the kind of, particularly in the minds of the health and care system, and you've got something, or we've got something to point out locally to say, there it is, this is why access to the natural environment is important and why it's an opportunity for promoting health and well-being. Having that as a foundation and a touchstone, I think, is quite useful. Something else that has really helped, I think, is the enthusiasm and commitment of, you know, some of those key people, some of those friendly faces within the system who have been banging on about this stuff for years and are still doing it. So although, you know, sometimes we think we can't replicate these people, we can't scale them, but at the same time, having them as allies to identify and work with is important.
That's really useful. Thanks, Rupert. So there's a question on the chat, I don't know if you can see it there, from Andy Edwards-Jones, saying, from the mapping project, the data shows a number of the lower percentage with access are very close to the coastline. So were open coastal spaces and beaches included in the data?
Ooh, good question. Yes, they were. Probably not in their entirety. So we've actually got a project going on at the moment, again working with ECEHH, to try and get a more consistent approach to how we've treated blue spaces or blue space generally, and also how we've tackled things like included the value of the coast path, which might not necessarily provide immediate access to a beach, but provides a view of blue space, the marine environment, that kind of thing.
Yeah, great, thanks. Yeah, and we've got Rachel here now, a researcher who's working actively on that, trying to improve our assessment of blue space access as well. So that's great. There's another question here from Jono Reeves from WWT. Hi, Jono. Just wondering how the local environmental NGOs are feeding into the Healthy Places agenda in Dorset.
Ooh, good question. Do you mean in terms of how we kind of engage with them, or what we're doing? I'll try and answer both. The Local Nature Partnership is a really strong ally for us and a really important facilitator, I suppose, to how we communicate and work with and try and find opportunities to work with some of our local NGOs. And they are hosted by Dorset Wildlife Trust. In terms of other kind of organisations and what they're doing, I think a lot of what I've been talking about this afternoon is projects that we're kind of directly involved in, but there is a huge amount going on out there that others are doing, which makes a contribution to prevention that we don't need or have oversight of. What we are trying to do, when I mentioned the workshop a while ago, is find a way to make it easier for some of those groups within the environment sector and within the health sector to work together more closely. And we're not entirely sure what that looks like yet. We don't want to create, too much of a talking shop or too much extra bureaucracy, but we are kind of feeling out what the opportunities are to, I guess, communicate better and share what we do, because very often there are fantastic little projects going on in Dorset at a very local level that others could learn from, but we don't necessarily know about. I'm not sure if that answers the question, but yeah.
That sounded pretty good to me. Okay, here we've got another question. So in terms of the green space mapping, did you try sensitivity with different distances, such as the Accessible Natural Green Space Standard in Scotland indicates 150 metres or a 2-minute walk is even more accessible?
No, we didn't. We did look at angst quite closely when, as I said, we decided to go with the WHO. It's not really a standard, is it? But a suggestion, for want of a better phrase. And we decided that the WHO limit was maybe more meaningful for us locally. One of the problems we had, or challenges we had, is obviously across Dorset we've got a much more urban area in the east and a much more rural area in the west. So trying to assess accessibility or find a meaningful standard for accessibility across that whole patch was quite challenging, which is why the two researchers we had working at ECEHH put a lot of work into trying to include the value of public rights of way in the open countryside, more natural spaces if you want, in our analysis. And the second question, I was wondering if you tried thinking about nudging process. Yeah, these activities among people. It would be interesting to know a bit more about what you think about that, or what you mean by that question, rather. One thing I would say is we've worked quite hard locally to ensure that certainly not everything, but a lot of the opportunities out there to engage with natural environments, either through publicising actual spaces or activities that can facilitate access to green space and nature, we've worked quite hard to embed that within the activity finder that Live Well Dorset use, and their approach to behaviour change is, theory-led. It uses the COM-B model, capacity, opportunity, motivation, to, I guess, try and nudge people towards a way of being physically active that they're most likely to engage in.
That's great, thanks, Rupert. Don't think I'm seeing any more questions, and we should probably wrap up pretty soon. Oh, sorry, there's one more popped up from Alex Curd. Do you see any research expanding to incorporate blue spaces as well as green spaces? Well, I'll let you go first on that, Rupert, and then I can follow up too.
So I think Ben and I already mentioned how we're working on trying to make sure we've adequately captured or tried to quantify access to blue space in our accessibility analysis that I mentioned. On the latter, how are we, or what are we doing around maybe demonstrating what we can do to increase access to blue space? No, we don't really have any specific projects on that at the moment. You were going to add, sorry, Ben.
Yeah, I guess I can follow up that.
Yeah.
Just I guess most folks on the call probably know that we have a pretty key sort of area of our research here at the European Centre on blue space as much as green space, and thinking about accessibility and use of watery kind of environments, whether they're coastal or inland. So we've definitely got an expanding research arena really that's been working on that, along with other folks around the country and internationally, of course, over the last several years really. So there's a pretty wide range of projects ongoing in that, some of them more local focused, but also, for example, the Blue Health Project, Horizons 2020 European project that's just in its latter phases now, starting to produce some useful outputs hopefully. So if you have a little Google for the Blue Health Horizons 2020 project, you should come across some stuff to do with that. And there's one more popped up for an anonymous attendee. Can you see that, Rupert?
Oh, no, I can't see that.
Okay, it's in the Q&A bit. So are you aware of any projects that are extending this to more rural communities? For example, farmers who may not be utilising their green spaces themselves as much as they could and could use them to improve their mental health, thus encouraging them to look after the nature on their land.
Ooh, brilliant question. And I think the answer is no, as far as I know. I mean, obviously, as I said, our colleagues at the local authority in Dorset Council in particular, improving the accessibility of the public right-of-way network and managing some of our local nature reserves, that kind of thing, is their bread and butter. So a lot of what they do will involve working with landowners and farmers, and needing their collaboration and goodwill in order to create some of the kind of more integrated trailways that we've got in Dorset. If we're talking about kind of opening up their land more generally, no, not that I'm aware of, but that doesn't necessarily mean it's not going on. I'd be interested if there are examples around that nationally.
Yeah, that's it. I'd be with you on that, Rupert. I think you're right, and I think there's relatively limited understanding really. A lot of the work in this kind of area has focused particularly on urban communities, and I think the work that we've been doing together, particularly focusing on public rights of way as the key kind of thing in more countryside kind of settings, is really important, because obviously the whole thing with green space itself perhaps not meaning quite the same thing in rural communities, but also that question about specific groups, whether it's farmers or other kind of population groups in different places, and their experiences of working with natural environments and being out there all the time, is probably fundamentally different. So there's some interesting stuff to be done there, and I think there are bits and pieces of research around, but certainly nowhere near the amount that's been done with urban environments. So an interesting area to be developed. Oh, okay, that was Jasmine. So she had the anonymous button selected. That's good. Thanks, Jasmine. Great. Okay, so I'm going to wrap things up now. I think we'd intended for this to finish under the hour mark, so I think we've done a good job between us. Some really nice presentation, thanks Rupert, and some really interesting questions. I think there's maybe one or two people who've had trouble getting into the webinar, so fortunately, as I say, we'll be recording these, making them available afterwards, and we'll let you know all know how to access that. One of the things we'll be doing with our SWEEP project is developing a hub on the SWEEP website specifically around this project to share resources, to share things, including these webinars, but also other sort of documents and resources that get produced. But we're really keen to build this network. I guess the whole focus of the SWEEP programme is particularly Southwest focused, but we obviously see that Southwest focus as situating within the wider sort of national and international setting. And also we're super conscious there's a lot going on already in the region, so we're really enthusiastic to learn about the other things that are going on. So I know that there's work going on, for example, across groups of LNPs across the Southwest working in this kind of area. And I know there's lots of other activity as well. So we're really conscious of kind of trying to make the connections and doing what we can to make use of this particular suite project as a means to kind of to build a network and to share experiences, best practice, to share our latest research, and trying to make it all work together in a collaborative form. So hopefully that's been useful and interesting for all of you. We'd be really delighted to get any feedback that you have. So if you've got any feedback after the webinar, please do drop an email to Sian. I think you should all have Sian's email address. Feedback, good or bad, would be great. Any suggestions for different formats or for other possible webinars, we're open to suggestion for other speakers. We're going to do these webinars roughly every couple of months or so. And the next one will be the end of January, so January the 31st in the same time slot, 1 till 2. And that will be our colleague Becca Lovell from here at the European Centre going over some of the sort of key aspects of our research and also our interactions with policy and practice, particularly across the Southwest, but also as it relates nationally and internationally as well. So we'll make sure those details get circulated nearer the time, but that takes us into 2020, so a little while to wait for that one. So I'll just wrap things up there. Thanks everybody for joining us, and hope to see you at the next one. Okay, thank you. Bye.